Another is transillumination. Transillumination can be done with our normal composite light cure unit. It is fairly important in case of fractures or baselines inside the crown. And when we are doing transillumination, we can see that light is not fully, not fully traveled through whole through the full path. There is obstruction in the on the fractured line. It obstructs the light, and light cannot pass through. The fracture segments appears brighter than the other parts, so it can help in diagnosis of the fractured tooth or cracked tooth. Then for the cracked tooth, the dye staining is also very important. After removing the existing restoration, dye staining is done, and after we locate that there is a crack, the crack is thoroughly cleaned with a round bar, small round bar. Sorry, can clean with a small round bar, and then fill it with a flowable composite, and later can cover it a full coverage restorations. We'll discuss some more cases. Bite test is useful for to check the percussion, or for the cracked tooth syndrome. We can use tooth slots or patient bite downs, and when he releases the pressure, he feel that there is pain. Okay. A rubber dam sheet can also be used